Hi, my name is Dr. Zoltán Mari. I'm the current president of Clark County Medical Society, and I'm also the endowed Ruvo Family Chair for Parkinson's and Movement Disorders at the Cleveland Clinic Lou Ruvo Center for Brain Health. Thank you very much for the question whether we should integrate technology and AI in our practice of medicine. And the answer is we don't have a choice. It will happen. Where we have a choice, or at least trying to have some choice, is to how it should happen, who should be the stakeholders who regulate this transition, who should be having a seat at the table where the decisions are made about the finances, about the regulatory aspects, about the rolling out and details to save our patients from potential misuse of the technology, from potential mishaps, and all the risks that it brings to us, because there are risks. Having said that, I want to emphasize all the benefits as well. In particular, when you think about medically underserved areas, and not just in the United States, there are many areas of the world which are profoundly medically underserved, where patients cannot see a doctor, not in any logistical way, anywhere near where they live, and medical facilities are nowhere to be found, and patients can die from not being diagnosed or treated for otherwise treatable conditions. So when you think about those medically underserved situations and crises around the world, and you bring in something that can be automated without much human resources or extraordinary expenses, without setting up practices and flying doctors into these areas, if you can think about how much of a difference that can make in many parts of the world, it's profound. So I am advocating for a proper transition, and I think it can help patients, it can help physicians. Bureaucracy is a big deterrent, and bureaucracy is one of the interfaces in which we fight insurance companies. On the one hand, we need to document everything properly. That's part of our job, and it can be a little bit abusive to doctors to over-document, and that is frankly, can be demoralizing for the profession that we are in, to having to spend all this time writing notes, orders, letters, peer-to-peer reviews, and all sorts of other documentations that come with the practice. Many of those things can be readily automated, and even now, there are certain apps and functionalities that allow a physician to sit down with a patient in the practice, take the interview as they normally take history and review of systems and all that, and every word that is said by the patient, by the provider, and by family members in the room will be captured, not only captured, but they will be molded into an integrated health record, into a clinic note that follows the normal structure, where review of systems items will go under the review of systems section of the note, and so on and so forth. It is fabulous. And we are going to use these to enhance our abilities to see patients, to document better, and also use AI in helping our diagnosis. There are currently available functions which can put together a history as well as a physical exam and the labs and other diagnostic tests, and offer the provider a long list of differential diagnostic list, which they may not have been able to come up with on their own. So those are all positives and all tremendously encouraging changes that integration of technology and AI can bring to our practice. But at the same time, we also need to be very cautious to not let the controls out of the hands of those who sworn up to the Hippocratic Oath and maintain their profession as somebody that wants to help patients rather than just using medicine to make money. Because if AI and other technologies are in the hands of organizations and owners that are interested in profits only, it can certainly have a negative impact on our public health, perception of health, and could be actually dangerous. And I think we are at a transition point in which we have to be very vigilant as to how the regulatory aspects are happening, who is sitting at the table, overseeing the proper transition of our AI transformation, if you will. And overall, there is hope, but things are happening sometimes a little bit too fast for us to properly process, react, and build the appropriate regulatory background for this. So overall, in brief, my answer is we don't have a choice. It will happen. We just have to be absolutely vigilant, to be at the table, to oversee the change so that it will be helpful to our patients and our community at large. Thank you very much.